Everyone, hello. This is James Bishop, APD of the residency program, and today I'm going to talk to you about emergency medicine milestones. So what are emergency medicine milestones? Well, emergency medicine milestones are basically a 1 through 5 evaluation tool that we will be using to evaluate our residents. It's basically a measuring device that we are going to use to make sure they are learning the skills necessary to practice emergency medicine. The ACGME requires that we train residents who are capable of practicing independently and unsupervised. In other words, we must demonstrate that they have competency. So how do we ensure the residents have competency? By doing milestones. Milestones, as you know, are a tracking device that you use on a trail to measure your progress towards your destination. Likewise, the milestone evaluation that we will be using is a 1 through 5 evaluation tool that will track the progress of the residents to their destination of being competent physicians. The ACGME has replaced time-based or experience-based training with something called competency-based training. When I was a resident, if you completed 3 years of emergency medicine training, you were deemed competent. That is no longer the case. Competency now is going to be determined on whether or not you successfully progress through your milestone evaluations. So to get a handle on this, the ACGME decided that they needed to define what it means to be competent as a physician. Is it just enough to take good care of a patient, or is it more than that? Well, we know in IEP that patient care is just one thing that you need to be competent in, and the ACGME recognized this as well. So they came up with what's called core competencies. And whether your ACGME program is emergency medicine, general surgery, or psychiatry, it doesn't matter. Every program is required to train the residents in the same 6 core competencies. We must train our residents to be competent in patient care, in medical knowledge, in system-based practice, practice-based learning and improvement, as well as professionalism and interpersonal skills. All programs, all specialties, you need to develop competencies in these 6 things. Well, as this progressed, the ACGME recognized that these 6 core competencies mean different things to an obstetrician than to an infectious disease doctor or a radiation oncologist. So they went to the different medical specialties and they said, you define the components or sub-competencies of these core competencies. This slide here looks a little confusing, but hang with me, it's really not that complicated. We talked about milestones, and they're a 1 through 5 evaluation, and they are basically a 1 through 5 evaluation of the components of emergency medicine sub-competencies. We have our 6 core competencies of patient care, etc., that all programs have. And then our college has defined 21 components of those core competencies. And the milestone evaluation will be a 1 through 5 evaluation of each of these sub-competencies. Down here, I've listed the 21 components of emergency medicine competencies. The first 8 here are under patient care, and they are items such as disposition and multitasking. So for our patient care core competency, we are going to rank the residents with a 1 through 5 milestone rating of each of these. We're going to rank them on disposition, multitasking, etc. And we'll do this twice a year. And you see these other items listed here are the other components of the other core competencies. Things like scientific knowledge, clinical reasoning, etc. Example, patient care. This is a core competency. ER has 8 components of core competency. One of them is emergency stabilization. So we will give them a 1 through 5 ranking of their competency of emergency stabilization. Another core competency is medical knowledge. Emergency medicine has 2 components of that core competency, one of which is clinical reasoning. We will rank the residents on a 1 through 5 milestone evaluation on clinical reasoning, etc. So I hope that all makes sense. It's a lot to digest. Basically, it's a big Yelp review. You know, this is a big evaluation on all the things that we think are important to make you a fully rounded physician. We're going to measure patient care, your interpersonal skills, how you understand how your actions with the patient affect the hospital system as a whole, how well you learn from your mistakes, etc. And a key component of this is you guys. The faculty that work with the resident every day are going to be filling out end of shift evaluations that are going to be critical to getting this to get information to plot their milestone evaluation. Here's an example of a milestone form. You see here, there's a competency over here. It's the competency of patient care. Here is the specific subcompetency, urgent and emergent medical conditions. And there is a 1 through 5 ranking based on these descriptive factors that we will fill out and plot their progress. By the time they graduate, we hope and anticipate they will be at a level 4. Level 5 is considered more like attending advanced resident. Here is an end of shift evaluation that most of you will see on a daily basis. The resident will send these to you via a text, and you'll go to an app called New Innovations, and you will answer these questions, which are specifically tailored to identify how they're performing the components of our subcompetencies. End of shift evaluations, these are so important. Please fill them out in a timely manner. Please make your assessments based on direct observation. That is going to be the most helpful to us. Please try to observe them doing these specific subcompetencies so you can comment on whether or not they can do them or not. And also, you know, recognize that these will help determine their milestone evaluation. So take the time to give us good objective feedback. If a resident's struggling, please let us know. Don't be afraid to give an average resident an average score. There's nothing wrong with that. There's always room for improvement. So that is it, guys. I hope that makes sense. I really appreciate everyone supporting us and for taking the time to listen to this talk. Milestones are a big evaluation tool that we'll be using on a regular basis, and you guys play a key role in that, so I appreciate your support.